Hey, Gary Bird with SMC National here. Just wanted to share a tip that should help you out when you're building your marketing campaigns for your dental offices. So, there's a couple different kinds of patients that you're going to attract when you set up any kind of dental office. You're going to have three different tiers of patients. And here's how I break these down: you have high trust patients, you have mid level trust patients, and you have low trust patients. So, let's work through these one by one. The high trust patients at the bottom of the funnel, these are going to be your patient referrals. These are your absolute best patients. They're hands down going to perform the best. They're the easiest to convert on the phone. They're the easiest to get into the practice. They're the easiest to get to accept treatment. They're the easiest to get to come back to the re-care appointment. They're the easiest to get other referrals from. These are the best patients hands down. And these are the kind of patients that everybody wants. The next tier, in the mid-level patient, is your insurance patients and like your drive-by or your location patients. So these are patients that have some form of being familiar with you, but not at the same level as a patient referral. They haven't been sold yet. But if someone's been driving by your office for 10 years and they've seen the sign and they know you're there and they see you in the community there's going to be a level of trust there, and that's good. Same thing with insurance. Though it's not as good, again, as the patient referrals, there is a level of trust there because you either accept their insurance or their insurance recommended that you go there or something of that nature. And those are your mid-level trust patients. Your worst kind of patients, and the ones that are going to be the hardest to convert, are going to be your low trust patients. These are patients that come from marketing. And you say, well, Gary, why are you saying this? I thought you were a dental marketer. We are, but we realize that these are the hardest patients. You have to win them over. There's a process to winning them over. There's a process to getting them into the office. There's a process to getting them to accept treatment. So why does anybody market? Well, here's the thing about it. The high trust patients, the patient referrals at the bottom of the funnel, those patients, you can't scale. You can't scale that number. You can try to get more and you can try to do things, but if I said, hey, double your patient referrals next month, you would have already done it. Right? You would have already took care of it. You're not going to go from 100 to 200 patient referrals overnight. Same thing when you open up a new office. If you say, hey, we're going to open up a de novo and we're day one, we want 200 patient referrals, it's just not going to happen. You're not going to be able to do that. So it's not scalable. The mid-level trust patients, there are things that you can do. You could join more insurances. I don't know if you want to do that or not, but you could do that. You could move to a better location. But again, there's only so much scaling that you can do there. There's only so much you can get from that. And then you kind of reach a peak. And again, same thing when you open up a new office, how many are you going to get month one? The reason that people market, and we realize this as a company, is because it's the only avenue that's scalable. It's the only model that does that. It's the only one that has a lever that you can pull. So what do we do? How do we approach this? Well, here's the secret. The goal is to treat these patients, these low trust patients, so well as they come through your office, and you have an amazing office and you have an amazing culture and you have an amazing process, and you bring those patients through your office, that those patients then convert into what? Patient referrals, the kind of patients that you want. So not only can we pull the lever on marketing, but over time, if you do a good job with those patients and you get them to re-care and you get them to come back, you can actually get the patients that you want and continue to scale and grow your organization. This is how we think about marketing at SMC, and really, I think that everybody should look at it that way. That's the goal. That's how we should be approaching things. Thanks so much for listening. Have a good day.